We're back at Dr. Cassis's office with patient Diane, who's going to be receiving a Radiesse treatment in her hand today. She received one treatment 3 weeks ago, and you can see the difference in this right hand, which has been treated, versus the left hand. Now, Dr. Cassis, tell us why Diane is an appropriate candidate for Radiesse.
As we age, we lose volume in all areas, including our hands. And so when we lose volume in our hands, the prominent bones and tendons become obvious to see. So we like to fill in with Radiesse or Sculptra to just repair the volume that's been lost, to not make it look strange, but just give it a little bit extra volume.
Okay, now how long does a Radiesse treatment last in the hands?
Hopefully about a year, maybe a little bit less just because of the dynamic motions of our hands, but usually it's about a year.
Great. Okay, Diane, are you excited?
I am.
Okay, I guess we're ready to get started.
Okay, so she's been sitting with some numbing cream on, and then we're going to do a series of injections in. We'll actually massage the Radiesse throughout her hand, and then when we're done, we'll just have her sit with some ice packs, and she should be ready to go.
Now, do the hands usually bruise or swell after the
They
treatment?
do, yeah, they significantly do, and there'll be a significant amount of swelling afterwards.
Okay.
So it's a good 2 to 3 weeks that it'll kind of come back down to normal. So normally we have patients come back in 3 weeks. Diane's going to be out of town, so that's why we went ahead and did this hand first, and then she'll be out of town for follow-up.
Okay.
Okay, all right, here we go. Just take that 2 by 2. Okay, so here's the first little injection. Sorry. So it's kind of boring to watch, but
Is it painful, Diane?
No.
Okay.
I mean, she's going to initially feel the first little stick.
How many injections do you usually do in one hand?
It just sort of depends. So we'll do sort of a bolus at this aspect of her hand. Massage that bolus out. And then we're going to go into probably 4 injections here. Okay, straighten your hand out for me. Okay, great. All right, sorry. Pinch.
So maintenance just once a year, about?
Roughly, you never want to let filler go back to your original state,
Right.
And then that way you'll have to do less.
So do a lot of people combine
I'll call
procedures with like the face and the hands
Oh,
so they don't want to
absolutely.
look uneven? You know?
Absolutely. Yeah, she definitely started with her face and then has worked her way down to her hands.
From head to toe, right?
Okay, so we're just going to do the 1 syringe, see where she gets with that. She may need to do another syringe, but you can see already where it's replaced
Right.
the volume. So
It really has.
going to swell a little bit, probably not a whole lot of bruising. She may bruise a little bit, and she'll just have to sit with the ice pack, and she's ready to go.
Great. Thanks, Diane, for being such a
Thank you.
trooper.
Thank you, Dr. Cassis.
No, you're welcome.